Welcome to Clearing the Air. I'm your host, Ishraf Najamuddin,
And I'm Aditya.
and we are unpacking the state of tobacco control in Malaysia with three experts who see the data, the digital tactics, and the enforcement gaps every day. Joining us are Dr. Tamir Arusu from the Institute for Public Health, Dr. Megat Amirul from University Malaya Specialist Center, and lastly, Dr. Tan Hui Xuan from the Ministry of Health. Welcome to the show.
Thank you.
So, basically, we jumpstart to our question sessions. And my first question is to Dr. Tamo. Dr. Tamo, you have just presented the data of smokers and nicotine users in Malaysia. In plain language, are more Malaysians using nicotine today than 3 years ago in 2023, or has the face of users just changed?
Okay, thank you for the question. I think the data from GAS 2023 is quite obvious, but it's different in different perspective. The nicotine uptake among adult and adolescent is still there, despite the smoking trend is going down. But if you can see that e-cigarette usage is quite high, and of course the e-cigarette usage is very high among those youth and adolescent age group. So I think if you want to ask me whether it has changed, definitely yes, it has changed because the product that's available right now, it's not like how it was when we did the first gas in 2011. Okay, even then I think we didn't have much question about e-cigarette at all. Very limited questions. For 2023 gas, we actually incorporated a lot of question that was very specific to e-cigarette. So GATT is like it's the internationally coordinated data survey. So we have a set questions that we have to follow, but then we also have a country specific questions that we have to ask, and we incorporated a lot of e-cigarette questions into it, like what are the flavors they use, how much ml, and all those things. So that part of the nicotine use is definitely on the rise, not only in Malaysia, but definitely that's the trend is you are seeing globally as well.
Oh, okay. Thank you, Dr. Tan, for the insight. Moving on to Dr. Tan. My question is for you is, there's a common argument that if we enforce strictly smoking-free zones in Malaysia, it will hurt small businesses. Based on your experience in Venva, is it true or is it just niche?
Okay, thank you for the questions. So this is not new. While we started the PEMBA in the year 2013, when we started to do the survey and all those, that was the biggest questions to us as well. Bear in mind that when we gazetted the whole Georgetown heritage zones, most of them are actually for business other than all those residential. So those are the first questions posted to us while we wanted to gazette the whole area as well. So at the time, we already have a data showing us that it will not hurt business. If it's not in a neutral way in your business growth, that means that make no difference while you are smoking or non-smoking. It won't affect your business, basically, it says so. Or in fact, it's actually when you impose smoke-free, there will be a positive business growth as well. And that also, we put it in our survey. We wanted to have a more evidence base. So we have this public opinion before we enforce this completely smoke-free in the Georgetown Heritage Zones. So basically, we want to ask among them how many support them. So in the subcategory group, we did analyze the business owners and their clients, how many supported if this at the times, non-aircon was not gazetted as a smoke-free back to that at that time. So we wanted to ask, what is their preference? What were their preference? And we got 95% from this subcategory analysis. They show their support. They will prefer a non-smoking premise. So data they say so is actually just a minority louder voice. So majority still support it. And the majority, if they ask that with the awareness past the past 10 years now, I think the awareness is dead. Most of the people will prefer go for a non-smoking any a restaurant or anything, and rather than you sitting together with the smoker just smokes beside you. So I think the social norms have been changed for the past 10 years. People are more comfortable in a non-smoking restaurant nowadays. Yeah.
Okay. Thank you, Dr. Tan, for confirming that hurting small businesses, but when we are imposing strictly on smoking-free zone is a myth. Moving on to Dr. Morgat, my question is for you that in 2026, how are Malaysian youth navigating the cool factor of vaping versus the health warnings imposed by the schools?
Thank you for that difficult question. We are not even half into 2026, so it's quite difficult for me to comment. But I do have few adolescent clients in my clinic that came to me because of nicotine addiction, mostly through vapings. And yes, most of them are influenced through social media. Imagine social media advertising is it's kind of like what Dr. Tabel said. There's a shift in nicotine usage, previously using conventional cigarettes towards e-cigarettes. Similarly with advertising, before this is a passive advertisement through billboards, through newspaper ads, which FCTC has already put a barrier to it, so we don't see billboards advocating smoking, to promoting smoking in our country anymore. But when you go to Indonesia, you still see them. Okay, but this is the traditional method of advertising, which is very passive, non-dynamic, is not evolving at all. But now they are changing to social media utilization, social media platforms, where it is very targeted. It utilizes learning process AI to learn the behavior of the users, and particularly it utilizes the what we call the weakness of adolescent, where they are very easily peer influenced, they are risk takers, reward sensitive, and they model through influencers. So they use all this as a dynamic marketing. So just imagine, like I said in my talk just now, just imagine before this you see billboards out there when you go, but now the billboard is inside your phone, sleeps beside your adolescent. So yes, they are easily hooked to this trend. And what if the trend was more is the trend is being portrayed as a normal lifestyle? They no longer market nicotine as a substance, but they know market the vaping as a lifestyle. Okay, it is cool. It is something that resonates well with your community, with your friends. It is something that makes you feel belong. So it's not only the cool factor, but it is actually the sense of belonging that the adolescent are really craving towards. So yeah, it works. That's why there's so many adolescent patients coming into clinic combating their drug addiction.
So, as a student myself, it's really surprising to hear that most school students nowadays are addicted to nicotine and e-cigarettes, because when I was in school, it wasn't normalized yet. So yeah, it's a shock to me to learn that now, currently, students are normalized to smoke e-cigarettes or even tobacco products. So moving on to the next segment conducted by Adikia.
So now, on my segment, I'm going to talk about solutions and actions required regarding the smoking and vaping issues. So our goal here is to find a way where we can move out from the problem of the pathway. So I would like to start the question with Dr. Tan. So Dr. Tan, if we want to close the compliance gap by year 2027, what is the most important change that we would need? Is it higher fines, or is it better tech, or more community policing?
Okay. This is also another hard question. So, like I mentioned in my talk just now, of course, when they look at compliance, it's a behavioral issue. So, we really don't have a good answer to it if we didn't have a good, better behavioral insight to know why people not compliant to it. Yeah. So, what we can answer now is based on the literature elsewhere and what we think that most likely it will help. And of course, in my slides just now is what is sharing from the PEMBA. So I won't say we have done more enough, but that was commonly what we are doing. We always say that we started with educations, but people, it is both way. If you didn't educate, people wouldn't know. But if you don't know, doesn't mean that you will follow. So, but anyway, having saying that, education, it must be the first steps. Without knowledge, without education, people won't know what is correcting, and the knowledge won't equip the person have the knowledge, have the literacy to have a more informed, more logic decision making. So this is what we are talking about health literacy, and it need to start up with education first. Empower our community with the education first. So do they know why we do so? So when we do the smoke free, we have to inform our public. It's not about this is no smoking. If you smoked, you will be fine. Instead of that, we need to know why we have to do so. What is the reasons behind we do a smoke free? So those are our reasons. Do you all agree with my reasons?
I do.
Any other peoples don't agree with why I do so? So that we already put in social norms and social support. So while we presenting why we do so, and let them think that they are together with us, that give us the best support to do the subsequent things. So what I said, that is education. While we do education, don't just do education. While doing education, we are actually do the changing the social norms. We are getting the social support. That the least things you should get it while you're doing any engagement. And we're telling about engagement. So engagement, what we used to do is everybody pull together. So what I learned from PEMBA is we really segmentize our different stakeholders. It has been more popularized now. So I think the all those in the researcher groups, we know better, have a more better focus group discussions, while we have a more focus group and not a diverse group. So they can't talk their language and you didn't have different perspective. So this what we are doing. We talk to the public, we talk to the politicians, we talk to the associations. So while we're doing the business, for example, who do you think that the best person to talk to? Do you talk to the small industry or you talk to their associations? So at our size, we actually talk to all the association head. So because the associations, once you get their support, they will assure their member this is the best for them. And another thing, FOMO, fear of missing out. If all the 4 associations are doing the same, do you want to be the one do differently from what your association advocate for? So we actually do a lot of these things. So those are, it's easier said than done. So there's no one thing to say that how to increase the compliance. There are multiple things. So I talk about educations, I talk about the engagement, and then the social behavioral. Then last part is the enforcement. So I always say enforcement is only being done for you have done everything, you have adjusting all the other measures. That is the last things that we need to be hard policy to those that you already tried all the other things, it doesn't work. That is our last choice. So evidence, enforcement should not be seen the only way to increase the compliance gaps, but it's the last resort that we can use for those, despite all this effort, still non-compliance. Okay, did I answer your question?
This was a very good answer, and I really got a very clear view from your answer where enforcement doesn't start. I mean, it's not good when it starts without awareness and education. So now, my next question is to Dr. Megat. So regarding the same issue that Dr. Sean talked, what kind of digital campaign could probably reach a 16-year-old, or we could say a person in adolescent age in Malaysia today, without sounding preachy?
Without some shit. That's very important, right? Because adolescents turn out very fast because when they think people are preaching to them, man.
Exactly.
Like you guess.
Very smart.
Yes. Okay, so let's unpack what the industry have done, what are the campaign that the industry has done. So what they did is actually they market it not only as a substance, but they market it as a lifestyle. So again, when you are doing things against it, don't just focus on the substance, but focus on a healthier lifestyle. Next, they are using peers. The campaigns such as tag your friends, things like that, right? So similarly, you cannot get older people like us. Oh, sorry, we are not that old, but we are considerably older than the adolescent. They usually don't listen much to us. So they need the peers among their same age to initiate the campaign and talk so that they can be in the same group. That is number 2. Number 3, you must make sure that the campaign give a cool enough vibes. Okay, so it's not only a campaign that say, I don't want you to do this. You have to give another option,
then that option must be cool enough for them to accept. And lastly, this campaign, this new campaign that you are doing, it must be something that easy for them to do. I can give you an example. For example, the way in the UM we do hebat henti elak basmi asap tembakau, right? So when we are doing that hebat in henti elak basmi asap tembakau, we are not focusing on the smokers themselves. We are actually finding those who are at risk. At risk means they are not yet smoking, or they are just trying 1 or 2 puff already, but they are not habitual smokers. We are focusing on them, getting them awareness that this is not healthy. What are the alternatives that can makes them replace these habits? And we are asking them to do social media posts, telling them what they have learned from this. So in a way, they will start to learn about hebat, they will start to learn about the danger of smoking itself, and they will start to come up with their creative idea. Because us, we are old enough, our brain is not more creative than you guys. So we cannot say what campaign works for us might be working for you. So you outsource the thinking towards the Tolasan them. And true enough, our IG, our Instagram, after we leave it to the Tolasan, to the students who handle it, it gets more followers. It is more active compared to when we are the one handling it. So it's actually the industry has their own tactics. Us, yes, we also want to have our own tactics, but our own tactics might not work well. So we outsource this to the adolescents who are not smoking, are at risk, but they can pull out their friends out of the habits. So that's how I would suggest.
That's a nice approach, sir. I also believe that maybe youngsters can educate youngsters more than adults.
Yes.
So what data that we could probably need to collect so then we can stay ahead of the smoking industry?
I think what's more important data is smoking is, we have a lot of products. You have cigarettes, you have e-cigarettes, you have hookah, shisha, rolled, Kiratex, and a lot of things. Tobacco industry will have all the data, especially the cigarette one. But what's more important for us is the KKM perspectives is how to reduce the intake of the nicotine. So that's why we have national data on a yearly basis. One of the data that we collected was illicit cigarettes, okay, and also we collected data on the price, okay, how much price. Actually, the cost of the price over the years has reduced. The purchase. This is not what is it's stated on the shelf. Okay, one of the things that we do is increase the price of a cigarette on a yearly basis, increase the tax and all those things. But look at the data. We ask the people, how much are you spending for cigarettes? If you look at the trends way now, so how is it possible that when you are increasing the cigarette price, but how much you're spending is going down? What's going on? Something is going wrong somewhere. So what that's more important is the illicit trade, the illicit cigarette that's coming in. You can increase the tax. You can do whatever that you want to make people to stop smoking. But if the purchase price is so low because of the illicit cigarette that's coming in, there was a study that was done that shows that 60% of the cigarette that's being consumed in Malaysia is illicit cigarettes. So the 40% are paying like, I don't know how much, 20, 30 ringgits per pack, but the rest are getting it for like 4 or 5 ringgit. So that is the data that we have to collect more often, and also have engagement, not only within MOH, other people like, how are they smuggling it in? How's the enforcement at the borders? So those are the things that's very important, that data that we need to collect in order to move forward. Thanks.
Okay, thank you so much, sir. I really appreciate the perspective that you talked about. So before ending our podcast, I would like to say that the control on tobacco is not about punishment to people, especially youngsters, but protection to them. And today, I would really like to thank Dr. Tamil, Dr. Shuan, and Dr. Megat for joining in the podcast with us. I really hope this podcast will help the youngsters in this issue. Thank you.
Thank you very much.
Thank you.